I am Dr. Sudhanshu Patwari. I am a gastroenterologist and liver specialist practicing in Ahmedabad for last more than 30 years and working at Sterling Hospital, Ahmedabad. Today we are going to discuss a dreadful disease called hepatitis, that is swelling in the liver. Mainly liver is affected by hepatitis B virus as well as hepatitis C virus. And hepatitis B and C virus, they spread by infected blood and blood products, infected syringes and needles, sharp objects, even unsterilized practice of the during the injection or the operation, it can spread. If the tattooing is done, the dental treatment is done, or the ear piercing is done with the unsterilized needles, it can spread by that also. One should be very careful in prevention of this hepatitis, because this virus, if affecting the liver, it can cause in a long term the hepatitis, the cirrhosis and the dreadful disease of liver cancer also. Now in India, about 3 to 4% of the general population is infected by hepatitis B. So the general carrier rate in India is about 3 to 4%. So you can understand the magnitude of the problem in our country. Hepatitis C is not much behind. About 0.5 to 1% of the population is infected by hepatitis C virus. The problem of B and C virus infection is that during the early phase of the disease and the infection, the person is not symptomatic. Patient does not realize the problem. The virus is in the body, in the circulation, in the blood, and affecting the liver for a long time. And over the years, it can affect and damage the liver. The patient is symptomatic by the way of causing mild loss of appetite, mild fever, mild jaundice, yellow urine, and by that time the jaundice or hepatitis has developed. In acute hepatitis, when there is a short history of jaundice and short history of exposure to this virus B and C, no specific treatment is required. And most of the time in hepatitis B, 90% of the persons will clear the virus on its own by immunity of the body itself. But such is not the case of hepatitis C. When virus C is affecting some person, 90% of the time patient or person develops chronic hepatitis, and on a long run develops complications of hepatitis C in the form of cirrhosis and liver cancer. So to prevent this virus, one has to understand the spread of this virus and the proper treatment of the viral disease also. This virus is also health hazard to the medical and the paramedical personals, that is healthcare professionals, and the infected person or patient can spread this virus to the nursing staff, to the paramedics as well as to the medical staff also. During the procedures, if the equipments are not sterilized properly, the hospital can also spread this viral disease. So the spread is by the injection, by the unsterilized needle syringes, by the unsafe sex and multiple sex partners, it can spread the virus B and C. And to prevent this, one has to resort to the safe sex practice, safe injection practice, safe sterilization practice, and safe blood transfusion practice. And by that we can definitely reduce the viral load and the patient load and the infection load into the society. The virus is also spreading by the injection in parenteral route So the patient who are on regular hemodialysis, they are more likely to get this viral disease, and one has to be very careful in preventing the viral infection to the patients of kidney diseases by the way of dialysis. The vaccine is available for hepatitis B prevention. So the vaccine should be given during the early phase of the childhood to prevent the viral B infection into the future. There are some high risk persons like patients who are on hemodialysis, the health care professionals, the medicals and the paramedical professionals, and the close relatives of the patients of hepatitis B, and they are the persons who should be regularly vaccinated properly to prevent hepatitis B spread. Unfortunately, hepatitis C vaccine has not been developed over the last many years, and we have to prevent this hepatitis C by the safe practice only. So one has to resort to this universal safe practice, the safe sex, the safe parenteral use, and the safe blood transfusion to prevent hepatitis B and C. But if by chance the hepatitis B and C affects the person, then there is definitely treatment available to us, and the most important thing is early diagnosis and early recognition of hepatitis B and C viral infection. For that, one has to be very careful. If there is mild loss of appetite, loss of weight, mild fever, and the yellow coloration of the urine or the eyes, one should test for hepatitis viral. The viral marker should be done to diagnose hepatitis B and C infection. In the acute phase, definitely no treatment is required except supportive treatment, nutrition and rest. But in a long term, if there is a chronic infection lasting for more than 6 months, the definitive treatment should be offered. For hepatitis B, definitive treatment is available in the form of nucleoside or nucleotide analogs. They are the oral tablets which has to be taken for a very long time to suppress this virus, or there is injectable treatment available in the form of PEG interferon and the tablets to clear the virus. For hepatitis C, definitely the treatment is available in the form of PEG interferon and the antiviral tablets. And in last 3 to 4 years, there is a new development of short course of oral tablets which can clear the virus in more than 90% of the hepatitis C patients. We are awaiting for the clearance of the Director General of Health Services for this latest treatment, but I think it may be available shortly in next year, so we can treat our patients more effectively to clear hepatitis C virus. But definitely, friends, think prevention is better than cure, and always think of preventing hepatitis B and C virus and spread this message to everybody so that we can reduce the viral infection load in this society, and we should win over this virus. There is a query amongst everybody that if person is infected by hepatitis B or hepatitis C virus, do you require them to isolate the person? But the answer is no, because the infection is spread by the unsafe sex or the parenteral route or by the contamination of the soiling of the skin. If there is abrasion of the skin, then the secretions or the blood products can spread the virus, but otherwise personal contact will not spread hepatitis or B or hepatitis C viral infection. If the person is infected by B or C virus, he should not be debarred from working in the healthcare also, except in the surgical operation theatres where they are not allowed to work. Otherwise, even in the nursing staff, in the paramedical staff, or in the nursery, they are allowed to work, because it does not spread the virus to the other person. The clothings or the utensils of the patient should not be kept separate, the water should not be kept separate, or even the glass should not be kept separate of the patient. And only very important thing is the sharp objects like razor, the common razor practice should not be allowed, or even the scissors. Even I would suggest that even the barber set should be kept separate for everybody, so that it does not spread the viral infection. But otherwise, the patient or the infected person should not be separated from the society. So friends, today I have tried to explain you the details of the spread of the hepatitis B and C viral infection, their prevention and their cure also. So definitely the treatment is available, but friends, prevention is better than cure. So always try to prevent this hepatitis B and C infection. Spread this message to your friends and relatives. Try to vaccinate the young children, the childbearing age women, so that the virus is not spread from the mother to the child, and we can prevent the viral load to the society. Thank you very much for your patient hearing.